Good afternoon, everyone. Welcome to Kids Health Talk from MGM Children's at MGM Healthcare Chennai. This is a weekly talk every Wednesday between 12 to 1 by pediatricians from our group at MGM Children's for parents on various health related issues in children. Our pediatricians have already finished 4 of these talks. These are all available on Facebook Live. I trust you have found them useful. These videos are still available. Please access them whenever you need and send them to anybody you think will find these useful. I'm Dr. ER at MGM Children's. With me today is Dr. Ranjith Kumar, our visiting pediatric neurologist. Dr. Ranjith is a pediatric neurologist, that is, a doctor who deals with diseases in children that relate to the nervous system. Frequently in our outpatient department, we find that children come with a common concern that parents will definitely want to know more about, that is headache. So the topic for today that Dr. Ranjith will speak about is headache in children, what parents need to know. Welcome, Dr. Ranjith.
Thank you, Dr. Nisha, and thank you, MGM Children's team, for inviting me and giving me this wonderful opportunity of interacting on a live medium with our wonderful parents. Please go.
So I'll start with the first question. I think many people would like to know how common is headache in children? We know adults have very frequent headache, but is headache a common problem in children? Could you tell us more about this?
Yeah, that's a very relevant and common question. Uh, Actually, headache is the most prevalent neurological symptom which we see in our OPD day to day. If you think about school absenteeism, that is like causes of children not going to school due to medical cause, headaches is in the third position. It's the third rank as a medical disease when you say the cause of school absenteeism. As much as 60% of children with who are age less than 10 years may have headache at some time point in their life, and nearly 20% of kids may have recurrent headaches. Like if I put in another perspective, 1 out of every 5 kids has a risk of having headache almost once or twice in a month. So it's that common. Yeah.
So I understand that headache is of different types in children. Can you give us a broad idea? Can you give our parents a broad idea of how the different types of headache in children? Maybe if you could keep it less technical for parents to understand.
So if we broadly try to classify or try to divide the types of headache, we can say it can be divided into primary headaches and secondary headaches. So to make it very simple, primary headache refers to any type of headache or any problem of headache where you don't have an identifiable medical cause to it. So it's just a headache without an identifiable cause. If you are able to identify a medical cause, say a fever causing headache, or a sinusitis or a ENT infection causing headache, or a vision problem, or we simply call it refractory error causing headache, or some sinister problems like brain tumors or brain lesions causing headache, all this will be categorized as secondary headaches. So by and large, the headaches which we deal in our practice is primarily a primary headache. So secondary headache is a less common entity, but more sinister one.
Thank you for making it so simple. So parents come often to our outpatient department and ask, my son or daughter has a headache. When is it that I need to be concerned? Is there some way that you can describe to parents at what point of time a headache is of concern to bring to medical attention?
Yeah, that's a very important question. I think this is the crux of the entire discussion today because if yeah, every child will come to a parent once in a while and say, I have a headache or I have a tummy ache. So with regards to headache, suppose it is recurrent by meaning like it is coming again and again, or suppose it is persisting, like it is happening daily and it is not remitting or it is not stopping on its own, or suppose it is associated with other problems like vomiting or some other neurological problems which is causing any deficit in the child. So these are the ones which are to be really concerned. So if you are having these kind of situations, it is imperative that you have to consult a primary pediatrician and they will be able to in a better position to guide you what can be done further.
I think that makes it very clear. So the reasons at which point parents should take their child to their primary pediatrician to consult about a headache. Often when children have headaches, many feel that they should get their eyesight checked to look for eyesight problems, because eyesight problems many feel are the common cause of headache. What do you feel about this, Dr. Ranjit?
Yeah, sometimes like many times in your OPD, parents come with a child with headache. They will already bring a slip showing that we have checked a doctor so and so, and this is the thing they have diagnosed. So headaches with eyesight problems, we call it technically as refractory error, can be rarely associated with each other. But suppose a child has a headache due to some other cause like migraine or some other problem, if there is an associated eyesight problem like a long sight or a short sight, we call it refractory error. This may compound the issue. So if there is such thing, it should be identified by a proper ophthalmologist evaluation. And if it is so, it should be rectified. So if you rectify an associated refractory error, that will make things simple, and the outcome of headache management will be better.
Okay, so you're saying, what I understand is you're saying that refractory error may contribute to this headache problem, and so correcting it will definitely help. Okay,
Sure.
thank you, Dr. Ranjit. That makes it very clear. Now, you introduced a topic of chronic and recurrent headache. Could you tell us a little bit more about this in a way that our parents can understand?
Yeah, so this may sound little bit overstretched for parents, but for a family or a parent with a child with a recurrent headaches, they need to understand these terms as well. So what we mean by recurrent headache is headache comes often, but in between the headache, the child is well. Whereas chronic headache or a persistent headache refers to a situation where there is a headache. In between, also the child has some kind of a baseline headache going on. So the definition of recurrence or definition of the frequency is very arbitrary. We can put it as once in a week or more than 3 per month will be defined as a recurrent headache. The most common cause of recurrent headache in children is, of course, migraine. Chronic headache, it could be multiple factors. It could be some reasons like a stress related headache or a tension type headache, or it could be a part of some other brain or neurological disorder as well. I think I have made it a little bit clear for the parents.
Yes, I think when parents have children with headache, it's good to understand what is chronic, what is recurrent, and what their neurologist or pediatrician is thinking in terms of.
Yes.
Often parents are very taken aback when they hear that their children have migraine. So, is migraine common in children or uncommon?
Yeah. Yeah. So when we reveal or utter the word migraine, some parents, as you said, they are taken aback that what is this term which I have never heard, or I thought this term happens only in an adult. It's not so. Migraine can happen even in a young child as young as 3 to 4 years of age. If you take about the primary headaches, which we spoke about just few minutes back, which is where there is no identifiable cause, a majority of proportion of primary headaches in children is actually migraine. So, what is migraine? Migraine is nothing but in a typical adult, they will describe one-sided headache, just a sudden attack with a severe throbbing is the word used for describing the quality of headache, with sometimes a feeling of vomiting, or they may have vomiting as well. Sometimes they have the specific terms called phonophobia or photophobia. By simply what it means is like having a difficulty in hearing sounds or voices, and difficulty in looking at the flashes of lights. So if this setup or a constellation of symptoms are present, we make a diagnosis of migraine. So migraine is essentially a clinical diagnosis. Clinical by mean like we discuss, we ask the history, we examine the child, we rule out other causes, and then we come to a conclusion it could be migraine. There is no way or no test like a blood test or a scan test which will say this is migraine. So basically what I'm trying to say is migraine is definitely there in children, and it is a diagnosis of exclusion that can be made by a good clinical evaluation.
That's very clear, Dr. Ranjit. Thank you. So I understand in adults, we often hear that migraine has triggers. Adults talk about, this triggers it, that triggers it. Does the same thing happen in children?
Yeah. So the most specific thing about migraine is a trigger. So migraine is always there, but it doesn't lead to headache every time. So there is some kind of a trigger which triggers the headache onset in migraine. So the triggers are various types. So to put it simply, it could be emotional, it could be environment related, it could be hormone related, it could be diet related. it could be physical. So many factors are there which can trigger. But coming to the common triggers, the most common trigger which we encounter is lack of sleep. Next is like a fasting or a hunger. Say a child goes to school at 7 a.m., doesn't have any meal gap in between, and it is now 12 or 1, they tend to get migraine headaches. So sometimes even hormonal changes in adolescence, like menstrual periods, taking some drugs. Sometimes dietary factors like excessive consumption of caffeine, coffee can precipitate a headache. Sometimes environmental triggers like high humidity, going out in the sunlight is a very common trigger. Going out in the sunlight, even sometimes like physical activities like exercise. So all these, any kind of stress, be a febrile illness. So all these, there are all sort of triggers for migraine. But to say common things are like lack of sleep, hunger, uh, some food items, and physical or emotional stress. So these are the common triggers of migraine.
That's very good to know. Thanks, Dr. Ranjith. I'm sure this is very useful for parents to understand, especially when their children are migraine. It's quite distressing to see. So if we can manage these triggers, as I understand, then your chances of having the having the headache is less.
The role of the parent is to try to identify what is a trigger which precipitates the headaches in their child. So it is up to the parents to identify and associate and identify the trigger.
Yes. So in my practice, we find parents come with children with headache and they often ask, why don't we do an MRI scan of the brain? Now, what is your response to this? At what point of time in the evaluation of headache do we suggest MRI of the brain?
That's a very important and a very nudging question. So every parent, almost all parents who come to us with a child with a chronic or a recurrent headache, they ask, should I get a scan done? So it's not like all or none phenomena. There are some specific situations where a scan needs to be done. I think it is relevant for a parent to know this thing as well. This may sound a little bit technical, but to put it in simple terms, any headache which is associated with some neurological problems, like say fits. Fits is called seizure in a medical term, or something like a difficulty in walking, something like imbalance, something like a weakness of one part of the body. So these are neurological problems. If there is a headache with this kind of neurological problem, definitely we go for a scan. Or something which is associated with symptoms suggestive of increased brain pressure. For example, the child may have associated vomiting and associated headache, and he may have a double vision, like seeing two things. So this is a situation where we suspect increased brain pressure. Definitely we go for a scan. The other situations are like there is a headache, recurrent headache going on, but recently the headache, the type or the quality or the frequency, there is a sudden change in the character. So that may suggest there is something sinister is going to happen. So in that situation, we may go for a scan. The last thing is young children, say 2-year, 3-year old, 4-year old, they may not be able to exactly describe what they have. So younger the children, it is better to rule out by doing a scan. By younger, I mean less than 4, 3, that kind of age. So these are the situations where one needs to go for scan. So basically, I want to put it very clear: routine CT scan or routine MRI scan for just a headache without any other problem or with a normal neurological examination is not warranted. A good clinical examination can rule out other problems, associated problems, and the parents need to be counseled and reassured that a scan may not be needed in every situation. So I think
that's really makes it very clear. So parents also understand at what situations would they also be concerned, thinking an MRI needs to be done. Is there a difference between CT scans and MRI scans in children?
Yeah, of course. Like historically speaking, CT came first, and MRI is a recent one. Both has disadvantage as well as advantage. CT scan, the advantage is it can be done in a fraction of a minute. Say it can be done in maybe 1 or 2 minutes itself. But the disadvantage is it doesn't give a detailed information about the brain structure and abnormalities. Other disadvantages, I know, like there is a risk of radiation associated with it. So MRI, there is no associated risk of radiation, and there is nothing like that sort of problem. But the biggest disadvantage in MRI in younger kid is it takes a longer time, 20 minutes, 30 minutes, and the child has to stay still in the machine, which is not expected out of a small kid. So they will be cranky and crying. So it may need a good sleep or sedation or sometimes even a general anesthesia. So the doctor will decide, will a CT suffice or should I go for an MRI? So I think the parents should follow the discretion of the doctor. What should they do? And obviously, we are there to help out, like if there is a problem in getting any of the scans done.
Yes. Thank you, Dr. Ranjit. Another question that comes up often is this checking of blood pressure in children. So, is there any relationship between checking blood pressure and children with headache?
Yeah, that's very important question because many at times a blood pressure check in children is missed. So any child age more than 3 years, there should be an annual mandatory blood pressure check. Leave aside whether they have headache or not. It's like a normal recommendation in Western countries, but many times in our country, because of busy practice, sometimes it may be skipped. So any child, the parents should get their blood pressure check at least once in a month. Suppose a child has a headache or a fever, it is mandatory to check a blood pressure because hypertension can present with headaches in children. So early diagnosis of hypertension can be done and it can be you can manage it very well. So blood pressure check is mandatory at least in the first visit.
That's very good to know, Dr. Ranjit. Blood pressure is a very important thing to check in children. Many parents ask, each time my child gets a fever, the child gets a headache. Should they be concerned about this? So many children, whenever they have fever, they say, I've got headache.
Yeah, this is a very common clinical scenario we come across. Say there is a 4-year-old child, he has fever 3-4 times in a cold season or a winter season, and he may complain of headache little bit. So headaches can be a part of any viral infection, which can cause fever as well. Sometimes migraines can also be triggered by fever, which we recently talked about. But definitely one needs to keep of other problems like will it be a brain infection, can it be a ear infection. So it is better to consult a pediatrician and to rule out other associated causes of fever with infection. By and large, fever itself can cause headache. So it's good to consult a pediatrician to rule out other causes which can present like this.
I'd like to just make a small mention for those who are listening. If you have any questions, if you would post it in the comment section, we would address it at the end of your talk. So, Dr. Ranjit, thank you for so much of good information about headache. On another aspect, many parents run into our outpatient panicking because their child has fallen down, and the child has a bump on their head and a bit cranky. So, how would you advise parents on this?
Yeah, this is the situation which I face daily almost.
Mhm.
So we have a 3-year-old kid. Father and mother are coming panicky, running into the office, and they're asking, my child has just fallen out of the cot, and he has a small bump or swelling over his head, and he's a little bit cranky and crying. So yeah, this is very, very common. So we have to check whether the child had any loss of consciousness, has any fits following that fall, is there any associated problem like vomiting or any other neurological features. These are the situations where one needs to get a CT scan or any other scan done. If things are very reassuring, like the child is otherwise fine, just a pain is there, local pain is there, no loss of consciousness, no vomiting, no bleed from ear, nose or any other site, otherwise child is okay, feeding well, parents are understanding, parents can understand our counseling. So it is good to reassure the parents. One may give just a routine scanning after every fall is not required unless there are specific danger signs or specific red flag signs.
Yes, I think that's also for parents to understand that when there's it's a bump on the head is actually above the area of the skull, above the brain is a covering of skull, and above that, isn't it?
Yes, yeah,
And when we're looking for these danger signs, we're talking of trying to look for a bleed, evidence of a
yes,
bleed inside the skull.
inside the skull. Yeah,
So really, the bump on the head is may not be significant.
basically every
This
fall does not lead to a bleeding inside the brain. So
yes,
if there is a bleeding inside the brain, we have specific clinical signs and symptoms. We will
which is what
we
we're looking for.
which is what we
Yes.
are looking for.
Thanks. That are really good things to know, Dr. Ranjit. So let's go to the another aspect. Is there of the management aspect? We've done evaluation and looking at headache. What are the causes of headache? Now, are there any home remedies for headache?
Yeah, so simple. For example, child has a simple headache or a headache which can be managed at home, like not that severe enough kind of a headache. One may try home remedy. For example, they may just ask the child to relax, rest. That sometimes giving a rest or a sleep itself may relieve the headache. Or sometimes you may apply some local balms or ointment like menthol. That can also help in relieving the headache. If the child is hungry or is fasting, you should give food, and that may relieve headache. If it is good to, painkiller can be administered, but I would not advise parents to get over the counter medications. Preferably with the prescription of the doctor, painkillers can be administered. So simple home remedies are can be followed with simple headaches.
Yes, that's very useful information, Dr. Ranjit. Thank you. Now, coming to a million-dollar question. So, do parents of children with headache have to limit TV time, screen time, iPad time? Is it important?
Yeah, that's really a million-dollar question. So very often, not only for headache, we also see children with seizures and fits. So the most common asked question is like, can I let my child watch TV, and how long can I allow them? So there are various international guidelines are available. To put it very simple, it's very clear for any child age less than 18 months, no screen time, not at all. Only video chats with family members are allowed. A child between 2 to 5 years, you can allow a maximum of 1 hour of a programmed it's a it's a programmed television program. So not like anything which is like useless or any other. And a child above 5 years, up to 2 hours is allowed of TV's time or a screen time. So I think parents in these era should definitely try to stick to these guidelines and prevent or limit screen exposure, TV exposure as much as possible.
That's very good to know. I think a lot of us as parents need to have these guidelines about TV time, screen time, because that's what a lot of our children are doing these days.
Yeah.
And I think it also requires a lot of effort to make sure your child is doing other things to entertain themselves.
Yeah.
A lot more effort.
And they can make this TV watching more productive also by choosing such kind of educational program content, like preferably. To put it simple, for a toddler, 1 hour; for a school going child, at the max 2 hours. And they may give relaxations during the weekends a little bit.
Yes. Thank you, Dr. Ranjit. Now we're in the middle of this COVID-19 pandemic, and to make it very contemporary, there are a lot of online classes going on. So, another question that will often come is that a child with a recurrent headache or a chronic headache, are online classes advisable, and how does one go about it?
That's really a good question, because parents are really scared whether sitting in front of an screen or a TV, laptop for a long time, does it trigger headaches or does it cause any other problem for a child? They are really worried about it. So the government itself has come up with guidelines. Like we have to make some adjustments. We can't do away with online classes because it's important for academic career. We can't skip the entire academic year. So it's good to have small sessions like 30 to 45-minute sessions, a gap of 10 to 15 minutes in between. And government regulations are saying at the max 6 sessions per day, not more than that. And they have put a limit of 28 sessions per week. So if any school is being like any school is forcing you to go beyond these expected timings or regulated timings, I think it is advisable to discuss with them. Other thing is, if your child is viewing with a small screen, it's better to use a bigger screen because the eye strain is less with a bigger screen. Try to maintain the distance which is recommended for each gadget or each screen which you are using, because the screen size and the time distance to maintain is depend on the gadget. So you can look at the specifications for that. And reduce the brightness as little as possible. Keep your child well hydrated. Give them sips of some drinks or sips of water in between. Give them healthy snacks in between, and give them gaps in between so that they don't feel stressed out during that period. So I think as a parent, we can't do away with it. We have to do it, but we have to make certain adjustments and make the entire class very conducive and very comfortable for the child.
Those are very helpful tips, Dr. Ranjit. I've heard of neurologists asking parents to maintain a headache diary. Now, could you tell us more about what this headache diary is?
Yeah. So any child or any parent coming to us with chronic or recurrent headache, we use a term called headache diary. We ask them to maintain this. So headache diary is nothing but a diary of this sort, where you can find a date or the day. You can also specify, is it a weekend or it's a vacation day or it's a school day. And did your child have headache on that day? What is the severity of headache? Which side? Is it front, back, or center? Or how long the headache lasted? Is it less than 30 minutes, 30 minutes to 1 hour? You can specify the timing. Was there any associated problem like vomiting or any giddiness, any other problem? And did you take any remedy or any medication and how it got relieved? So this will ask them to maintain, say, for 2 3 weeks or a month. So when they come back to us with the next visit, can identify the type and the pattern of the headache which the child has. This is a very simple tool which will help us in this identifying this. It may also guide us whether the treatment which we have given is working or not, and which will help us in taking further remedial course if it is not working. So headache diary is a very important and simple tool. I think every parent who with a child with migraine or recurrent or chronic headache should use the headache diary.
Yes, I think that's also particularly useful because you tend to forget how long it was, what, so it's easier to just write it down and carry on, and it also gives your doctor a better view.
True. True.
So thank you, Dr. Ranjith. Now, we have many adolescents and teenagers coming, especially at the times of prior to exams, with headache. Now, is there something called stress headache in children, adolescents?
Yeah. So many may think that stress or tension type headache is only seen in adults. It's seen even in pediatric or children as well. Yeah, it can be put it as a tension type headache or as well as interchangeably as a stress headache. So it can be any kind of tension or stress. It could be a physical or it could be an emotional. For example, a child sitting through a class for a prolonged timings can also get stress, or they may have fear of exams, stressed of this exam burden of preparations. So this can also be a stress for them, or sometimes even a physical stress like doing an excessive strenuous activities, maybe the sport or anything, can trigger this kind of headaches. So very often we see such situation like particularly during this exam season, adolescents coming to us with a vague type of headache, but they will not have these characteristics of migraine. That is like, it is not one-sided, it is not associated with vomiting, it is not associated with the other features. So we will be able to make out what it is. The treatment is mainly to relieve that stress factor, relaxation, avoid the stressor triggers, and parents can be reassured, and the child should be empowered, and child should be empowered to, for that whatever difficulties she is going through should be addressed. For
Yes,
example, if the child has a learning difficulty associated with that, we need to identify it and we need to sort out this with the school or with the teacher.
that's true. Many people ask about triggers of headache. Does head bath cause headache? Does diet cause headache? Is there something you can tell us about
Yeah,
this?
so when we come to these miscellaneous triggers, like sometimes head bath does trigger headaches. Like there is something called head bath headache itself, but we see few kids when they have long hairs and all, like when they come to us, they take a head bath and they don't dry it immediately, they get headaches. So it's better to limit the number of head baths to as much as minimum, like maybe once in a week, and use a dryer immediately if possible to dry it. And yeah, so these are the techniques one can follow if they get headaches with head baths.
Mm.
Second thing you asked about is diet. Yeah, this is a very common question parents ask us. Should I follow any specific diet or should I avoid anything? Of course, diet is very important with respect to general health of a child, but with relevance to headache, you need to follow a well balanced diet, like a three major meal and a three minor meal. Three major meal everybody follows, but three minor meal sometimes may get skipped, like a protein rich healthy snack like pulses, eggs,
Yeah.
or vegetables, fruits. All these are healthy snack options. Next is you can avoid specific things which can cause headaches like dark chocolates, excessive consumption of coffee or caffeine. Even sometimes some guidelines say this monosodium glutamate, which is a Chinese food additive. These kind of coloring agents, additive agents, all these can be avoided in the diet. So to summarize, three major meals, three minor meals, healthy snacks, healthy diet, balanced diet, and avoid fasting. for any child with headache.
That's very good to know. Um, Coming back to that, we were talking about stress headaches in teenagers. Now, I recently had a child adolescent, who their parents noticed that every time, just prior to going to school, of course, it was many months ago, just prior to going to school, there would be this headache. This headache would not be there, and it would be quite debilitating. She would be crying, but this headache would not be there on weekends and holidays. At the end of the evaluation, we thought that there's possibility of a functional headache. So this concept of functional headache, I think, is something that maybe we can, if you can describe to parents so they can understand what it is.
Yeah, this is also important because we do come across such situations, like in order to gain something or in order to avoid something, children tend to develop this kind of an habit. So the word functional refers to no organic. Organic means there is no medical problem or medical cause to it. There is nothing abnormal, but there is a headache. So some simple trivial gains, like no, doesn't want to go to the school, doesn't want to do homework, doesn't want to prepare for the exam, or so these are some simple trivial reasons. Or sometimes even bigger reasons or more problematic ones, like an family problem, parental conflict, even sometimes child abuse. All these concerns may be there. So it is good to identify what is the difficulty with the child is having, what is the stress or what is the emotional trigger with the child is having. Try to avoid that. For example, if the child doesn't like to go to school, it is better to discuss with the teacher as well as with the child, like what is the problem, and try to rectify that problem. So that is the solution for this kind of functional headache. If it is severe and if it is not manageable, it is better to take an opinion of a child psychologist as well.
Yes, that's really good information. Thank you, Dr. Ranjit. The thing I've noticed about functional related issues is what happens sometimes is parents and community people feel that the what is functional is something that the child is purposely doing. Therefore, they think that addressing the situation, just stop doing it, works. But I think what you're saying about addressing the underlying problem, what is the reason that the child feels stressed enough to have a functional headache? As I understand, is
Yeah,
that an
yeah, this
important
is
thing?
really true. Like every time, like they say headache, it may not be true that they are faking it. So
Okay.
they may perceive the headache really as well. So faking a headache is different
Yeah.
from having a functional headache. So I think one need to identify this what is the underlying problem, and uh, I think one should not rebuke the child that you are faking it. You are
Yes, very
why are
important.
you saying this like that? Rather than identifying the underlying problem and help to get through this.
Yes. I think sometimes we find that children who are under stress and having functional issues, it's much more of a long term thing to treat than an organic, isn't it? It takes a lot more time. Um, so that's a wonderful overview of headache. Parents, I hope you have found this useful. Thank you, Dr. Ranjit, for this.
Thank you.
As you've mentioned in various parts of your conversation, but I think maybe could we have an overview of lifestyle changes that will help children with recurrent headache to decrease the intensity? Lifestyle changes really makes a lot of difference in many illnesses.
Yeah, of course. To summarize, like with regards to recurrent, frequent, or persistent headaches in children, more than medical pharmacological measures, like by pharmacological, I mean like giving medicines, it is the lifestyle measure which is the cornerstone of management. So parents should know what are the lifestyle measures which they should follow, and it is the role of the primary pediatrician or the neurologist to emphasize them to follow the lifestyle measures. To just simply to understand, I have a small acronym. It is called SMART.
Oh,
SMART. SMART. S stands for sleep, M stands for meals, A stands for activity, R stands for relaxation, T stands for trigger avoidance. So parents can just simply remember the word SMART. So sleep, they should follow a consistent sleep hygiene, consistent sleep patterns. They should have a bedtime routine. A child of a school going age should have 8 to 9 hours of sleep. Maybe she can have an half an hour nap in the afternoon as well. So following a good sleep pattern, preventing sleep deprivation will go a long way in preventing headache. So that's the most or the primary lifestyle measure which they should follow. Next, of course, is meals. So we have spoken about meals. So to summarize, a well balanced diet, 3 major meal, 3 minor meal, avoiding unhealthy foods, including more healthier options. Next comes your activity. Activity is the one part which many try to miss or neglect or forget it, because in this era of like indoor and nuclear family, kids tend to just uh, forget this activity thing at all. So 1 hour of physical activity is recommended at least 5 times in a week. So for any school going child, maybe it could be a running, it could be skipping, it could be dancing, swimming, any kind of activity, either indoor as well as outdoor, but it should be like a physical activity, not like chess or carom board playing. So that's a physical activity.
Yes.
Coming to relaxation, by relaxation I mean taking rests in between. They can even follow some relaxing techniques like yoga if the child can prefer it, some meditation techniques, breathing exercises. All this will relax their uh, overall body as well as the mind, so that it will prevent recurrent headaches. The most important and the last is trigger avoidance. So the parents should identify the trigger. We will help them in identifying what are the triggers which they are having. If they maintain a headache diet, triggers should be avoided. For example, a child has a headache after fasting or avoiding skipping a meal. Parents know skipping a meal causes a headache, so they should not skip a meal. So trigger avoidance. So sleep, meals, activity, relaxation, trigger avoidance. These 5 things, if you follow, I think even without a medicine, you can get away with a migraine or a recurrent headache. So it's very, very important for
That's
the
really super. Great to have an acronym because it makes it so easy to remember. And I think another big factor is that children these days are so permissible to talking to. A lot of them will understand these things and help in the situation themselves.
Yeah, sure.
Thank you very much for all that information, Dr. Ranjith. We have a question from a Prashant Girish, who asks, when you have a bump on the head, if there is an associated pain, should they be more concerned? You have a
Yeah,
bump on the head and the child also has associated pain, should they be more concerned?
yeah. I think we did talk about this. So if the child has a bump as well as a pain, it is possible because the external injury itself is causing the pain, the blunt injury. It doesn't mean it is inside the skull, it is inside the brain. So we will look for the factors like vomiting, bleeding, any fits or any loss of consciousness. If none of them is present, I would just advise a painkiller and prefer. But it is good to consult a pediatrician,
Pediatrician.
because parents may not be able to identify all the signs.
That's true.
So
So always consult your doctor, but this gives you guidelines.
guidelines, yeah.
Yes. But it tends, the bumps may have pain. Yes.
Yes, it may have pain.
Um, I hope parents you found that very useful. Um, thank you very much, Dr. Ranjit, for coming and speaking to us. If there are any more questions, shall we wait for a few minutes to see if there are any more questions? We will, yeah, you can enter those questions even now in the comment section. If we can't get back to you today, we will get back to you definitely. Thank you very much, Dr. Ranjit. Thank you for taking your time out of your busy schedule to come and stay. She will be talking about proactive parenting. What parents can do to prevent a lot of the accidental injuries, ingestions children come to our emergency room with. So we hope you will join us on that at 12 o'clock on next Wednesday for a talk on proactive parenting by Dr. Anita VP. Thank you.